All right, good afternoon and welcome everybody to the Hawkeye Parent and Family Webinar Series. It's a beautiful day here in Iowa City and things have been really exciting this week as the end of the World Series and many of our Chicago Cubs fans on campus are celebrating and enjoying the big win. And thank you so much for attending with us today, even though you could be watching the parade either live or on TV. So we're excited that you're with us today. So my name is Danielle Martinez and I work in the Office of Academic Support and Retention, and I will be your moderator for today's webinar. If you're unfamiliar with our webinar series, they're hosted on the first Friday of each month from noon to 1, and we hope that each one provides you with some up-to-date information that might apply to your student's transition or experience here at the University of Iowa. We know that parent and family members play a vital role in student success and that they often might ask you questions, and so we want to make sure that we give you up-to-date information about what's going on here on campus. If you can't attend every live webinar, that's okay. We record them and post them later. And so for more information or future topics or to sign up for our webinar series, please visit parents.uiowa.edu and click on the Resources tab. Each of our webinars has a short presentation and then a question and answer portion where you can get your questions answered by our campus experts. So today we're going to talk a little bit about mental health and student disability resources. And we're really thankful to have 3 of our wonderful campus experts with us today. So the first is Dr. Barry Schreier, who is our Director of the University Counseling Services. The second is Mike Benson, who's the Assistant Director of Student Disability Services. And the third is Nikki Hodes, who's the Assistant Director of Student Care Initiatives in the Office of the Dean of Students. And so today we'll go over a little bit about what counseling and mental health resources look like on campus, as well as resources for students with disabilities, and then what does overall student care and assistance look like, and then we'll be sure to have a question and answer portion. So each of our presenters bring a wealth of knowledge about mental health, student care, and student disability resources, and we'll go ahead and start off with Dr. Barry Schreier.
Okay, thank you very much for attending today. I wanted to talk with you about the University Counseling Service. The University Counseling Service is the main counseling service here on campus. We are a staff of psychologists, social workers. We provide a variety of different services. One of the first services that I want to chat with you about is group therapy. We'll go to the next slide. So group therapy is a brand new service that we're offering here at the counseling service. One of the things that we're aware of with group therapy is this. Our students work in groups, they live in groups, they go to school in groups, they socialize in groups, they're raised in groups, and they do everything in groups. And one of the things that we know also about our students is that they often come and relational problems are at the root of many of their concerns. So we have increased the number of group services that we're doing. We currently offer 12 different what we call general therapy groups, and at this point in the semester, all 12 groups are full. So we're finding that if we share the idea of coming to counseling and doing counseling in a group format, students are interested because they too are aware that their concerns largely are relational in nature. The other thing that is nice about our group therapy is a long-term service, so students can come and participate in group therapy for as long as they like. We have students that participate in group for 3, 4, 5 weeks, and we have students that have been in our group therapy for over a year. So when talking with your students about seeking services, you might mention to them the idea of group services in addition to the usual typical model, which is our individual services. The counseling service, as I said, is comprised of a number of different professionals, and we offer services in a variety of different ways. Individuals, I mentioned, our group service, which I wanted to highlight to you today. We also offer drug and alcohol services, and we also offer case management services. Let me tell you a little bit about our relationship with student health and wellness. So let's go back a slide if we can. There we go. So let me tell you briefly about student health and wellness. Student health and wellness is the student health service, and we work with student health and wellness because they are the location in which psychiatry happens. And so the psychiatrists and our psychiatric nurses are located in our student health and wellness center, and we work in close collaboration with them because often our students are needing not only counseling services but also maybe needing medication services. If your student is on campus and is taking psychoactive medications, you have a couple of options. One option is to keep care exactly where you have it now, which is at home. and your student might be able to continue to benefit from a relationship that is already stable and a relationship that they already know. Or your student may bring their care onto this campus. It is the common model for the University Counseling Service for us to engage in not only medication, but also in counseling. So when talking with your student about these services, you may also want to suggest to them that not only do they attend to their medication needs here on this campus, but also to their counseling needs. We are located in several different locations, which I'll talk about in just a second. But the other thing I wanted to mention to you is our referrals. So we are a brief model program, meaning that we try to provide as much service to as many students in as quick a time as possible, which means that we can't possibly provide services to everybody who comes seek it for as long as they possibly may want it. And so what we do is we offer case management services. Our case management services are services that we offer to hook up with your student should we make the decision with them that they are needing longer-term care or beyond the scope of service that we provide. One of the things that we are aware of is that students were taking referrals from the counseling service in the days of yore, and we knew that their persistence to seeking those services was about 20%. So if we told them to go seek services in the community, only about 20% of students were actually going to persist and do that. With the addition of our case manager, where we have professionals on staff who know all the private practitioners in town, who will sit down with your student to talk about insurance, talk about transportation, and actually then make that initial call to set up that initial appointment with their students, our persistence rate is now over 80%. So over 80% of students that we send to counseling onto campus are persisting to do that. And then we're going to do follow-up care with your student as well to make sure that that connection has been made and that that connection is a positive one. As I mentioned, Student Health and Wellness is a really giant partner with us, and again, we collaborate with them in terms of making sure that we coordinate not only the counseling needs of your student, but also their medical needs. The Seashore Clinic is also a clinic here on our campus that I want to make note of. We can get full at the University Counseling Service, and we can get into a waitlist situation just about this time of the year, so we rely on other campus partners. The Seashore Clinic is a clinic on our campus that is run through the Clinical Psychology Doctoral Program. These are students who are becoming licensed psychologists who are under the supervision of other licensed psychologists, and they provide a clinic on our campus that provides counseling services. The difference with this is that there is a fee, although it is a sliding scale fee, and it is a training clinic. So anybody who does go to receive services there is going to be within a training clinic. What we know about the Seashore Clinic is that the service is top quality because in this situation, your students not only going to have the eyes of their therapist on them, but the eyes of the therapist supervisor. So it is a high level of care. And if for a referral into the community, this is a very inexpensive option that also does not necessarily need to involve insurance if finances are tight for your student. Another one of our campus partners is the Women's Resource and Action Center. RAC, as it is known familiarly on our campus, also provides counseling services. These are doctoral students in our counseling psychology program, also under the supervision of licensed mental health professionals. This service is completely free. This is also considered a in-the-community resource because this service not only sees our students, but also sees members of the community for a variety of different services, which you see there listed on your slide. This is an excellent, excellent resource. And again, students can go to RAC for services when the counseling center is at waitlist to receive additional services in either a short or long-term way. So, there is a wonderful resource page that is out there for you called the Transition Year. This is not only for your student, but it's also for you, the parent. This is an external vendor website that we connect with called the Transition Year. And if you're a parent or a family member who has sent your student to the campus for the first time this year, this is a wonderful place to go to find additional support services, especially for you as parents, in terms of things to expect, to ways to better understand your students' reactions when they contact you from school, maybe to express concerns or distress, and then additional resource opportunities for you as well. So if you have not checked out transitionyear.org, I highly, highly recommend that you do. It is a really excellent, excellent external vendor service that we provide to you as Hawkeye parents.
Excellent. Thanks, Barry.
Yep.
So my name is Mike Venz, and I'm the Assistant Director of Student Disability Services. What I want to share with you, we just have a couple slides to talk a little bit about what our office does on campus, some of the accommodations provided, and once again, if there's questions, feel free to ask at the end, as well as you can also reach out directly to our office because I do understand that in this type of situation with confidentiality, you might have very specific questions about your son or daughter, and we want to make sure and we address those in a nature that's appropriate for you. So first of all, what our office does, we provide equal access. We try to remove barriers in regards to providing academic accommodations to students with documented disabilities. So as you can see on the slide, assuring access to reasonable accommodations to qualified students who currently demonstrate a condition producing significant functional limitations in one or more major life activities. That's a very legalistic way of saying there's currently some sort of limitation and there's documentation that supports that. So as you can see, this is not an exhaustive list of the types of accommodations that we have. There's more available accommodations listed on the SDS website, which we can make sure and highlight later. But some of the common accommodations our office provides, I think we have over 850 students right now that are registered with Student Disability Services. The most common accommodation would be exam accommodations. So let's say a student needs extended time for testing. That could be for quizzes, midterms, and finals. Typically we say 50% extended time, so that would be 1.5 times whatever the class examination time is. So say for example for finals, instead of 2 hours, a student that is eligible for extended time would be eligible to take it in 3 hours. Required readings in alternate format. If a student has a print disability or something that keeps them from being able to access print materials, we create accessible PDF documents and provide them electronically through the course management system on campus. That's what the required readings in alternate format would be. And we have assistive technology available for free download through the ITS software download site that students can download software for free to either Mac or PCs. Class notes, we might have students that might need assistance in regards to accessing information that's being presented both verbally and auditorily in the, or visually in a classroom setting. And so class notes would be finding a volunteer note taker in class. That's something that we ask our instructors to do. And so that is another common accommodation. Every student that's registered with Student Disability Services is eligible for early registration. So we work with our registrar's office and we allow for students, once again, that are eligible and have completed their intake with SDS, they can register on day 2 of our registration period. That is a huge perk, especially for students that are first, second, and third year. They get to register at the same time as students who are graduate or professional students. So it opens up the door for students being able to, let's say, pick courses that allow for more travel time in between classes, as well as, let's say, medication might be have a better impact, let's say, in the morning versus the evening. We have students that can try to have access to courses that best fit their schedule. We also offer deaf, hard of hearing services, so if a student needs, let's say, an interpreter or any sort of multimedia captioned. Attendance statement, this is something that's specifically considering what the webinar topic is today. We do have students that might have some sort of condition that might impact their ability to attend class. It could be, let's say, a condition flares up or, a depressive episode, something of that nature. We can ask instructors to be aware of that fact and work with students in regards to attendance and their policies and such. Spelling and grammar in class and world language substitution, that's pretty common, usually for students, let's say, might have a learning disability or some sort of disability that impacts, let's say, if you're handwriting an essay and a quiz, instead of being able to use some sort of word processor to do spell check and be able to move material around electronically, we ask instructors to be aware of that. The world language substitution, if your son or daughter has a disability that impacts their ability to acquire a world language, that is something that we could try to petition through the college, and they would take other courses to substitute that requirement. So this is a slide that most students don't like to see, especially when we're presenting at summer orientation where we talk about, hey, these are the differences between high school and college. But I think that there's a couple of these bullet points that are pretty key. So the first one on the left, you can see in the top left, it is in high school, least restrictive environments, IEPs, 504 plans. The school is responsible for basically, reaching out and finding out which students need extra help. And it is the school's responsibility to establish a lot of that care and assistance. When you graduate from high school and you come to the college level, the responsibility changes to the student's responsibility to advocate for themselves and say, hey, I have a disability, I might need accommodations. So that is something that is a huge change. SDS is the office on campus in which students are supposed to say, hey, I need accommodations, can you help me out? So once again, the difference between high school and college, the responsibility changes from the school system itself and teachers to the college level where it's the student with the disability that needs to advocate for themselves. And the second piece is regards to who provides the evaluations. Now, many school systems we have, there might be psychologists and social workers and individuals that are helping out with, let's say, IEPs or 504 plans where the evaluation is done in the school and it is the school's responsibility to help provide that. Here at the university, Barry mentioned some wonderful resources like Seashore Clinic, and there's local practitioners that can do the testing, but it is not the SDS office's responsibility to to provide that documentation. It's the student's responsibility. And so some of the referrals to local practices, or if we have students that might have already established care and they have, let's say, they want to keep their care back home, there might be a psychologist, let's say, for example, back, where the student is from, that might be able to write up documentation as opposed to needing to find an evaluator here. But once again, it's on the responsibility of the student, not the institution. And so applying for accommodations, it's a couple pretty straightforward steps. The first thing is you need to complete the SDS application. It is available on the SDS website, and I believe it's SDS, oh, it's at the bottom, yay, sds.studentlife.uiowa.edu. Under the section, or Students tab, and then hit Apply. But complete the SDS application. It's a two-sided form right now. The first side is basic demographic information. The second page has two main questions. One, tell us about your disability and how it impacts you. And the other question is, what types of accommodations are you interested in receiving at the university? Okay, so pretty straightforward. Once again, for step 2, submit appropriate documentation. It's your the student's responsibility to submit that. If you're not sure what types of documentation is needed, you can go to that link at the bottom, and we have documentation guidelines. Ideally, we like to see documentation that is relatively current. So let's say it's something from when the student was 6 years old and now they're 18. We might want to provide more. We might want you to have more current, updated documentation. But if you submit what you have, we can review it and let you know exactly what you need. In regards to the student receiving a written response, if it is a current student that is enrolled at the university, we will email them as soon as we find out, determine their eligibility, because we don't want to delay the process of students receiving accommodations. So if they're off campus, and let's say it's a prospective student, we usually try to mail it, because not every student's already checking their UIowa email as a high school student. But for current students, we email and we try to get the student in right away. So the accommodation process overall, the way it works here, the SDS office, we are the gatekeepers of that information, right? So the student will apply, we determine eligibility, but then for the instructors to find out, for that process to start, students need to schedule an intake appointment. Once again, we will email students once they're determined eligible. They come in and meet with one of our staff members, and we have a staff of 6 professional staff. And so they come in and meet with one staff member, and we fill out what we call our letter of accommodation. So on this letter, it will have the student name and student ID and some basic template information for an instructor saying, hey, the student's registered with SDS. Please consult with them about what types of accommodations, and we specifically list in bullet point fashion, so it's very easy to reference, what types of accommodations the student's eligible. So it could be, let's say, extended time for testing, reduced distraction environment, books in alternative format. So we work with the student to modify that letter and make it unique to them. The student then brings that to their instructors. They don't just email it to them. We asked, ideally, students go and schedule a time during instructors' office hours. We want there to be some interpersonal communication, and we allow the letter of accommodation to almost be an icebreaker between the student and the instructor. Our instructors are trained during new faculty orientation as well throughout many other opportunities in which we communicate with our instructors to say, this is the way that students with disabilities are to communicate with you about their accommodation requests. And so very often it's a very easy 3 to 5 minute conversation. Let's talk about this. This is what's going on. Here's my eligible accommodations, and that's how that process happens. So you'll see the third bullet point, contact your accommodations coordinator if you're having any sort of questions or you're not sure about the process. You see the fourth bullet point, no news is good news. What we mean by that is we assume that unless you contact us back that everything is hunky-dory, you're working well with your instructor, and the accommodation process is going well. So just like it's your responsibility to advocate for yourself and speak up if you need accommodations, if anything with the accommodation process happens to be just going in a direction where you're not sure, you have a question, let us know, and our staff member can help with you. And the last point, each semester this process needs to happen. Okay, so the letter of accommodation might not change that much. The accommodations might look the same, but in regards to checking in and making sure you're communicating with each instructor each semester, that is key. Let's see here. Just a couple other pieces. You need to follow through with making the intake appointment. Sometimes we have students that submit documentation, like let's say in August, and they think they're ready to go and that their instructors automatically know what accommodations they're eligible for, because that might have been how the process worked in high school. Once again, the student needs to come to our office, schedule an intake appointment, and they need to bring the letter of accommodation to their instructors. That is the communication process. Accommodations do not replace the need to study hard in every class. These are supplemental. So let's say a student's eligible for note-taking assistance and they get a copy of someone else's notes. They still should be attending class. They still should be studying. They still should be doing their readings. This is meant to supplement and allow a student to access the to be able to gain access to the knowledge and also be able to demonstrate the knowledge that they're gaining. We are seeing this in regards to the University of Iowa campus. Students need to be able to self-advocate. They need to be able to communicate. They need to be able to be proactive. Having mom and dad, do the emailing and do the calling, that's just not a good strategy for successful students on a college campus these days. And so we want to make sure we promote that. It is important, especially when we promote this to students, as soon as they start contacting us, let's say freshman, sophomore year in high school, that they have a disability, we encourage students to say, why don't you start speaking up at your IEP meeting, or why don't you start speaking up at your 504 meeting? You need to be able to do that once you get to college, because that is what you need to be able to do when you're successful. And the last piece, sometimes families or students think they need to schedule an appointment to be able to register with our office. We encourage families, students, parents, if you have questions, contact us, but by no means do you need to schedule an appointment to be able to apply or before you apply. You can literally send in the SDS application and documentation at any point, even if you haven't reached out to our office before then.
Thanks, Mike. So my name is Nikki. I'm with the Office of the Dean of Students, and I'm here to talk a little bit more about student care and assistance. So really the role of the Office of the Dean of Students is to engage students, to support positive community behavior, and really to help enrich the college experience. And we know that sometimes things can come up that are unexpected in a student's journey, challenges, that can really impact that ability to have that full college experience. And so the Office of Student Care and Assistance is a way to try to help support students with that. We know it's a big university with lots of different resources, and we know sometimes those challenges can make things difficult. So really our office helps students to navigate those challenges, provide options for them to be aware of, and really to help them gain access to the resources we have on campus. So some of the expected challenges that you might see, just some examples, could be medical conditions that are chronic or kind of new and unfolding during their time here. It might be a hospitalization, could be mental health concerns, interpersonal concerns between students, a loss of a family member could come up, natural disasters. Unfortunately, if there were to be an apartment fire, where do they turn for housing and for books, and how do they work with that? Those are kind of some of the ideas of what we work with, but it really can be kind of anything that kind of comes up. And if it's not our office that can provide that support, we'll also make sure to connect to that appropriate place where they need to. Now, one thing I do want to highlight, though, with our office, and I would say all the services we've talked about today, is that we work not just with students living on campus, but off campus. So we know that many of our first-year students currently reside on campus and hopefully have a lot of great touch points, a lot of great follow-up between maybe housing staff with them. But once they begin to move off campus, which we know is a lot of students, and they're beginning those plans as we speak, they get a little bit more of that independence. So knowing that we are still offices that can work with them to help navigate those experiences, I think is really important so to be aware of. So as I talked about, student care and assistance is really an office that can help navigate the larger university setting and just resources in general. I think that advocacy piece that Mike spoke about is really important. And while advocating and saying, I know I need something, it's also figuring out what is that next step and where is that? And that can look differently depending on the student, depending on the circumstances and their trajectory too. So I like to say that we provide a lot of options as to here's what exists at the university and really help the student talk about what they deem and see for themselves as going to be the best path for them towards their success. So we will also review and consult on reports and different concerns. So sometimes we will have a concerned faculty, staff, student, or even family members contact us to share kind of concerns about their student that they haven't reported to you yet. They haven't shared with anybody. And we're happy to talk. I often talk with family members about sometimes the family just wants knowledge and information about the university resources to share to their student, and that's not a problem. We're happy to share that. And sometimes it's that we'll initiate some outreach then to the student to invite them to come to our office or encourage the student, the family, to have them contact us. And I think that's really important. We know the important role that you all as family play as partners in this work, and that you know your student better than we do. You've known them for 18 plus years, and so even if they're here for 4 or 5 years, you still have that huge history, which I think is important. We also have a reporting form on our website, which you can see listed, which does provide an anonymous option as well. So that's also there if you want to be able to send an email. Another thing that we provide is the On-Call Dean program. So one thing that we know is going to the emergency room is never fun. I can, as an adult, as an older adult myself, even when I have to go at times, whether it's with my child, it's scary and it's new and you're not sure what's happening and you might be in pain. And there's a lot of those factors. And so trying to navigate that experience as, a first year student specifically, but really kind of that emerging adult, can be difficult. So we operate an on-call dean program. So on weekends, beginning at Friday at 5 until Monday at 8 a.m., we will have a full-time staff member available to go to the hospital if a situation were to occur. So these really are primarily situations that are more medically based. So we would talk about, an emergency surgery type of situation or maybe mental health concerns. So we'll be notified by housing and staff members or the University of Iowa Police when that occurs. Students have the right to decline the visit, but we want to really make sure that they know about the resources that exist. And so then, because that's one of the big concerns is, well, what about my classes? Sometimes students are looking at needing to be in the hospital more than a few hours, it might be days or even potentially longer. We just want to make sure they know that there's a touch point and we can take care of that in the meantime, because they really need to be focusing on their health at that point. So that's a piece that we do provide. We do know students can go to the hospital outside of the weekend, but knowing we'll be open at 8 a.m. the next day, that allows us to still continue to make that touch point a few hours after. Other things that we do that are really important to our success is really coordinating our efforts with our campus partners. We really are a conduit to a lot of the resources on campus, and that's essential to us, is the work that we provide. And we know, it takes a village, and that's what we're here for. So some of the things that we do partner with to provide is the early intervention team, and that is co-chaired by the Student Care and Assistance Dean of Students Office, as well as Academic Support and Retention, who's providing the webinar today. This is a collaborative approach where we work together, and it has multiple of our campus partners, because we also know the value of having a holistic look at a student, not just simply one report from one class, but what's happening in all of their classes. What's the experience going on in the residence halls? Are we seeing some other factors coming on that would be really helpful to paint a larger picture? We also think that it also helps to coordinate the efforts. So the student's not receiving 10 different outreaches from 10 different people that have different pieces of knowledge. We're really trying to coordinate the effort with each other for that support. So we will work with students for that. This program is in its 5th year. Last year we had over 370 students that we worked through the program. And we know that that's really, like I said, really important for that cross-disciplinary collaboration. The mental health concerns, as we've talked about before, our office, we're not counselors, but sometimes we're a place that folks will come to that they're feeling comfortable, and we can kind of really help make that referral and kind of really help them, I think, to maybe have some reflection and understanding the positive benefits of that piece. So I think that's an important differentiation, but to know we're happy to be that support and that connecting piece for them. And similar to what I talked about before, we work with any kind of the medical concerns that come up. And again, having conversations with that student about what's best for them and their healing, as well as maintaining their academic record. And sometimes that may mean adjusting some expectations for themselves a little bit, but we're going to be there with them if they want us to talk about that. And for academic concerns, you can see listed, these are a variety of the resources that we partner with often in our office to try to provide that support.
Thank you so much to all of our presenters about great information about student care initiatives, student disability resources, and mental health information. We're now going to move into our question and answer portion of the webinar. So please remember that we have lots of folks attending, and so if we're unable to answer questions about specifics of your student's experience, but can provide sort of general information that might be helpful in guiding your student. If you have a question, type it into the box on the side. I'll then read the question out loud so all our participants can hear, and then our presenters can answer the question. If you're unable to get your question answered during the webinar, we can follow up with you via email to answer the question individually. So it already looks like we have some questions coming in. So the first is, at orientation we were informed about FERPA, which is the Family Educational Rights to Privacy Act. So then the question is, how can this parent or parents best communicate with each of our offices regarding this person's student's concerns? What can you share and what can not be shared?
I think that's a great starting point, and that I think is a great concern to have, which means, are we following the law, which is always, yes, we are respecting your students' privacy rights. The nice thing is, though, is you are free to share any information with us, and I think that's really helpful. As I talked about before, you have knowledge of your student for most likely many years, and so that information can really help enlighten the work that we do with your student. Now, in terms of what we can release, we're going to work with students on that to see what they would like. I'll often talk with a student if I know that a family member has connected them or connected or shared information with me to share, ask, what would you like me to share with your family? Is there anything that I can communicate? And we'll talk with them about signing a waiver to release that information too. I can definitely talk about general policies, I would say, at the university, and that's a good thing to be aware of, as well as resources, which can often be helpful. So those are some kind of the basic information that I know my office can share, which would be DINA students.
Yeah, I think very similar response from the Student Disability Services perspective. We do offer to students that they can sign a consent form so that information can be released to and from parents, or actually to anybody, and at any point they could revoke that. We try to encourage, obviously, there to be a good triangle of communication in the sense of we don't want to be the go-between between let's say mom and dad and a student. We're part of the puzzle, but we're not, I'm not a mediator or facilitator, and so making sure, just like how it's important for students to advocate about what types of accommodations they might need working directly with instructors, I try to encourage students to keep open lines of communication as well with family members, and many times it could be other support, it could be maybe a sibling who's also in college. And so trying to work with the student to encourage what is the best form of communication. I have some parents that are reluctantly, texting back and forth with their son or daughter because that's the easiest way for the son and daughter to communicate. For example, they don't want to do FaceTime, or they don't want to Skype, or they don't want to email. I know some families try to, schedule like a weekly phone call kind of a thing. So in regards to, if you want to know exactly how your son or daughter is doing, I try to encourage that kind of behavior and communication style to work with your son or daughter. But in regards to what information we can release, unless there's a consent form signed, we can talk about general policies. And many times I can answer a question that a parent might have without releasing any personal information about the student. So if you're not sure, you can call and ask, and the staff member should know what they can or can't release.
I would say the same thing as my colleagues. The one difference at the University Counseling Service, because we're licensed mental health providers, is that we don't fall under FERPA, we fall under state privacy law, which is much more restrictive than FERPA. But it is the same policy as my colleagues have shared, which is we require a signed release of information in order to speak with you. That being said, we have parents call all the time, and what you're going to get told when you call our office is two things. You're going to get told, one, you can call us and not tell us the name of your student. So if you call us and you decide not to tell us the name of your student, we're not going to create any kind of record of your contact, and we're going to simply consult with you. Kind of like Mike said, is we're going to sort of talk about broad, general sorts of things with you and try to advise you as best in terms of the information that you share as to next steps to take. If you call us and you decide that you do want to share your student's name with us, especially if we are seeing your student in counseling, is we're going to create a record, and we're going to say to you, anything you share with us, we're going to share with your student. Again, the idea is that we don't want to sort of get in between folks or be the keeper of secrets or allow for any triangulation. And we're going to advise you on how to best coach your student to take next good steps. But again, anything that you would share with us, we're going to create a record for it, an actual clinical record, and then we're going to share that information that you called, expressed concern, and we'll do that in a good way, obviously, but that we will not be keepers of any sort of secretive information. And so we want to give you choices. We want to give you informed choices about communicating with us about your student. And lastly, we want to encourage you, as I said during orientation, and if you came to my session during orientation, you heard me say you're the ears and eyes on the ground of students, and you will see stuff long before any of us may ever see them. And so we encourage your consultation and we encourage your contact, and just want to let you know up front in an informed way of the conditions of sharing information with the University Counseling Service.
Thanks so much for the clarification. I think one of the common themes that we've heard about is the ability for students to self-advocate. And so we have a parent who's looking at, can you share some strategies for how a student might be able to self-advocate, particularly with professors or instructors?
Sure. So in regards to one of the first ones, be organized and understand, like time management and such. Sometimes I'll have students that say, well, my instructor wasn't available during office hours, or I had class during that time, or I don't, I'm not sure how to communicate. Like, or I emailed my instructor 2 days ago and they haven't responded. And many times we try to, when we're problem solving, it's like, okay, first of all, don't be reactive, try to be proactive. So in regards to establishing how to advocate for yourself, understand what your role is and what your responsibilities are, and then maybe we could work in once again, an organizational way. Do we have it laid out, and have you synced your university email and your calendar to your phone? Typically students use their smartphones and they bring them everywhere. In fact, I walked into somebody today who walked into me because they were on their phone while they were walking. But making sure, how do I communicate? What office do I need to communicate with? At what time of the year should I communicate with somebody? For example, my instructor might be available Monday, Tuesday, from 10 to 11. Maybe I should reach out to them on the Friday before and say, hey, I was thinking about stopping by office hours to bring you my letter of accommodation. Thinking about just being proactive. Who do I need to communicate with? What method of communication works? What is a reasonable time frame for that? Many times we can provide students with the information about what resource or what referral, but making sure, like, so how are you going to reach out to them? Do you need to schedule an appointment? Can I just show up, let's say, at the Dean of Students office or UCS, or maybe I should look into when they're open and all that kind of stuff. So I think a lot of it, for me, comes back to what I've seen before is having the time management and organizational skills. That is key.
And I would share, too, that I think if your student is aware of some ongoing concerns, they might not be in the immediate need of that impact, but potentially anticipating that this could come up during the semester. I think it's really helpful to, if they're comfortable, to start engaging with their faculty ahead of time. So take, for example, maybe a student who's knowing they're going to be dealing with some treatment, maybe like radiation concerns, for example, and they're going to need to be out of class periodically throughout the semester. Talking with the instructor from the get-go, from the very beginning, so the instructor can plan ahead and think about that, but also have some realistic conversations about, are you going to be able to be successful in the class given some of those concerns too? Because knowing there's levels of accommodation, right, but there's also a minimum standard that faculty need to hold to make sure that the class counts for the credit and that your student gains the knowledge that's really needed too. And so I think that pre-conversation, if we anticipate some concerns coming up, and then that not constant, maybe that means something different to students, but that ongoing conversation with updates, I think can be really helpful. It's much more difficult when I meet with students in November saying, I've had this going on all semester and I haven't said anything. That's a lot harder place to kind of navigate from versus I've been working with this all semester.
So we have another question, and I think, Nikki, you really talked about how sometimes physical health or even mental health that Barry talked a little bit about can lead to sort of an extended period of time where the student might need to not be at the University of Iowa. And so is there a way that parents and family members can maybe help notify the university if a student is going to be absent from classes?
Yes, that's a great question. So when we say extended time at the university, we would really consider that 5 days in a row or more of time. If it's really looking at being gone for a day or two or a few days, we would really encourage a student to communicate directly with the faculty member about that need. However, when we are thinking about those really longer periods of time, we know that can be difficult. And so minimally, it would be we could contact the Office of the Dean of Students with that. It could be an email even, or the Office of the Registrar. And what can happen then in those instances is we will have the Office of the Registrar send an official notice of absence to the faculty member for the student. Now, it doesn't give a pass to say you don't have to make up what happened, but it still let the faculty member know that there are some extenuating circumstances that are necessitating the student being out for that extended period of time. It can really kind of help, I would say, smooth the path a little bit in those communications. And a student would hear from me once I've sent that out. I would respond to the student too to share, how you need to follow with your faculty as well. Start the emails going to talk about what's going on in the class and what can be made up. Now we know though that some of these ongoing concerns can start negatively impacting grades, and it's a balancing act, and that's a conversation I have often with students, because the thing is, we know when health concerns are happening, we need to be able to focus on the healing and care, and that can really impact our ability to do well in the class. So when we miss classes, we're having to make up what was missed, but then also keep pace with the class still moving. And can all of that coexist with overcoming the health concerns? And I know that's really difficult conversations, but again, looking at what are the students' plans for success, what are their ultimate goals, and how do we balance all of that, also knowing we need them to be healthy too to do that. And those are conversations my office often has with students.
And I would back up what Nikki says. As I think probably the only faculty member sitting at this table, I encourage everything that Nikki and Mike have said with this sort of broader encouragement, which is students, come talk to your professors. When we don't know who you are and we don't know what you're dealing with, and all we see is sort of the absence of you and the absence of your work, we don't have a lot of choices. As soon as we find out what's going on, it gives us a lot more opportunity to help you make the connections with services on campus, connect you with resources, and do some game planning, as Nikki suggested, in terms of how to best proceed through the semester. But professors can be seen as scary, unapproachable, big power differentials and those kinds of things. But in the end, it behooves us as well as it behooves our students for our students to do well. And so encourage your student to contact the professor. And it is a great process, as Nikki suggested, which is maybe that introductory initial email and then that face-to-face to go in and speak with the professor. And if that does still seem too overwhelming, often larger classes are going to have TAs, which are teaching assistants, and that can be a good initial approach, is to talk first with the teaching assistant, and then if needed to then go talk with the professor otherwise. But come tell us what's going on. It really does help us help you.
So we have a question about a parent or family member who might suspect that their child has ASD or autism spectrum disorder, so very high functioning generally in the classroom, but might need some additional assistance, but some questions about where to get tested or sort of where to confirm or where would they get that done.
So we have case management here at the University Counseling Service, as I mentioned in my earlier presentation. Our case manager is a good source of contact in terms of looking at services within this local community that provide testing for autism spectrum disorders. Or there might be someone back home where you are in terms of receiving those services. But we do have folks in this community who do testing for autism spectrum disorders. We also offer at the University Counseling Service a group for students on the autism spectrum to work on social skills, time management, all the executive functioning, interpersonal skills as well. And if we make the decision along with your student that not only is that group needed, but maybe some additional contact, we can provide that as well. But a good place to start for our campus is with the University Counseling Service case manager, who can make recommendations to you for testing and its costs.
Thanks, Barry. Just a quick note, we did get a comment from somebody that says that their student uses SDS and everybody has been really great and it's been a painless process and very helpful and all the faculty have been accommodating. So it's great to hear good news.
Good news.
We have one last question and then we'll go ahead and wrap up for the day. So are there any strategies that each of you would recommend to help maybe coach a student or even maybe convince a student who is trying to sort of handle it all themselves and that reaching out can feel like not an option or something that they're not wanting to do?
Yeah, one common thing I'll hear sometimes about that next step piece from students that I'm meeting with is not having the time. So they've got all the different classes that they're attending. Maybe they're attending additional supplemental instruction or tutoring to try to help with that, as well as work, as well as student organization commitments. So they feel like they don't have time to add another support piece for them. They don't have time to go to counseling. But we're really talking about that kind of experience of, well, an hour of counseling, what is that going to really benefit you in the long run in terms of addressing all of those things? So for me, that's been something that I found has been really helpful, that students have started to kind of have that aha moment of, yeah, taking a little bit of that time to focus on me is going to, in the long run, help me to be more effective in doing all the things that I hope to do. So that's one strategy, but I'm sure others have many, many more to share.
Yeah, so one of the things that we highly recommend to students is this, is we say to them all the time, anxiety loves nothing more than itself and depression loves nothing more than itself. And so anxiety and depression are function in a way to simply make anxiety worse and to make depression worse. And so this can be a common message of that kind of thinking, which is, I can handle it, I can take care of it. And this can be sometimes the voice of somebody who's really struggling. The double edge of this is that we tell our students all the time, you're students and take care of yourself and look how smart you are and you're accomplished and you got to college. And so there's the double rub of, we say take care of yourself and reach out for services, but also rely on yourself because look how far you've gotten yourself. That being said, this is probably the time in life that people have as many resources around them as they do. I, as a faculty and staff member, don't have this many resources available to me as students have available to them, and certainly at the cost that it comes, which is largely without any additional cost whatsoever. So we encourage students to engage in as much prevention as is possible so that they can attend to these concerns before they get out of hand, because again, depression loves nothing more than itself, and anxiety loves nothing more than itself. And a student can seek out resources without having to sacrifice their own self-reliance.
And the last thing I want to throw out there is, and Barry alluded to it earlier, speaking up to instructors, many times just by the nature of, like, let's say the name Student Disability Services or University Counseling Service, that there's a stigma involved. And so many times we have instructors that may be in that position where a student might feel comfortable, hey, I've heard you lecture, I see you frequently enough, maybe I just want to go back to office hours. And so encouraging students to make those connections with instructors. Many of our instructors will also make the same referrals that, let's say, you might as a parent, but it just comes across from this, as Barry said, the power differential, like, oh, but you're an instructor, you're so knowledgeable, you mentioned this, oh, I'm going to quit go. So making sure that referring to instructors, I think, can be a really powerful tool. And we've seen students that have been successful because they're able to make a connection with maybe one staff member or one instructor. And so that is a really important resource. If they're having problems, let's say, going to SDS or UCS, talk to your instructor. The instructor might be able to refer to an appropriate spot too.
Awesome. That was a ton of wonderful information, and thank you so, so much for sharing with us information about student care, student disability services, and mental health resources here on campus. So just to make a note, all webinars will be posted online at uc-uiwa.edu/family-resources. Kind of a lot, or just the parent and family website, which is parents.uiwa.edu under resources. If you were unable to get your question answered during the webinar, maybe you wanted a follow-up, please feel free to email us at uc-retention at uiowa.edu for a response from a University of Iowa staff member. And just a note, many of us have different websites or things that have been on the slides, and if you go to our YouTube page, which is also tagged through our website, you can get all the links available there. So just a quick note, please join us next month, which is about managing the winter break transition, because it's almost here. It's been a fast semester, which will be noon to 1, and it will be hosted by Academic Support and Retention and the Academic Advising Center. So thanks so much for joining us today for another Black and Gold Friday, and on Iowa, go Hawks!